Great. So let's just very briefly glimpse at several modeling approaches. Okay. So the first of them we're going to take a glimpse at is system dynamics. System dynamics is both a perspective and a methodology. It has a very strong sort of strong perspective, almost philosophy associated with it, and it's very much aimed at sort of managing feedback-based systems. It focuses on feedback and accumulations as key components, but it's distinguished by several things: qualitative and quantitative modeling traditions, an iterative sort of modeling process that seeks to deliver value from very early on. It has, for decades, invested in techniques for working with diverse stakeholders, but at the same time, it has a really rigorous mathematical foundation that allows you to generalize some of the models and access to a rich set of analysis approaches that reflect this. And it's supported by an evolved set of software that focuses sort of on what's being described rather than how. Okay, and as a general field, it tends to be focused on changing people's mental models. Because we're going to be coming back to this, I'm just going to skip forward here, but many of these things I've been emphasizing this morning of models as thinking tools have been in many ways stimulated by a lot of the philosophy in system dynamics, where changing mental models is viewed as a key aim of many projects. So much of system dynamics is used in a participatory context, sometimes in teams, sometimes with communities. Within system dynamics, we have a depiction of a system in terms of some very simple but powerful building blocks: stocks and flows. Stocks depict kind of the current state of the population, the current situation, and flows depict the change. These are kind of the nouns, the stocks. The verbs are the flows. The flows are dependent on the stocks, and the stocks are dependent on the flows over time. There's this kind of interactive components of it. The flows dictate how the stocks will change over time, but they are the strength of those flows depends on the value of the stock. If you have lots and lots of people with prediabetes, you're going to be getting more people developing diabetes than if you had no people with prediabetes. So we have these interactions between these two, and stocks and flows interact to determine very complex evolution of the system. Because the system has well-defined mathematics underneath it, it's subject to some very powerful types of formal analysis that probably most of the people in this room will not be interested in, but certain tools can take advantage of them to yield some very powerful methods for understanding system behavior, such as what feedback loops are governing the system's behavior over time. Much of system dynamics is formulated around feedbacks and accumulations as conceptual constructs. And whatever type of complex systems approach you are undertaking, these will be very useful ways of thinking about a situation. Even if you're not describing the system in terms of them, parsing the system's behavior in terms of them is very useful. So a classic example of a feedback is one that probably many of us are subjected to right now. We feel hungry, and if we feel hungry, we're more likely to go get food, and that will sate our hunger. That will lessen our hunger. That's a balancing feedback. On the other hand, there's feedbacks that are reinforcing, where an original change ripples around and amplifies the original change, not just pushes back against it. An example of this might be, if you have two individuals, let's say a mother and child, right? The baby's health is poor, and it is in a foul mood. It may lead to the mother also not her affect being adversely affected, which ripples through again to sort of worsen the baby's the baby's interaction and affect itself. Or there may be feedback involving infectives in a population. The more infectives there are, the more people get infective, and the more infectives there are yet. It's a vicious cycle that can result. You can also have virtuous cycles. You help someone, lift them up a little bit out of poverty so they can get better access to transportation. It opens up opportunities for better jobs, which provides them with even more resources and further betters their condition so that they can hold down a job more easily, etc. They can live closer to that job. So that's a virtuous cycle. And that's a reinforcing cycle. So system dynamics involves a central focus on these sort of feedbacks. Notable strengths of it is the ability to capture dynamics of continuous variables like regulatory processes, as we'll be talking about, ease of rapid model prototyping, support for participatory modeling from very different types of folks, and modeling that brings in many viewpoints, and the ability to characterize a model with basically an absolute minimum of programming. It's not really programming in the sense that you would be used to thinking about it, but rather we're characterizing the structure of a system in a very graphical but rigorous way and seeing what the consequences are. And then via formal analysis, we can reason even more powerfully about it. And finally, it provides strong support for intuition building among modelers and stakeholders. So that's system dynamics. Let's talk about agent-based modeling. And we're going to be going through each of these two techniques this afternoon. What's distinguishing features of agent-based modeling? Well, we have one or more populations of actors, of types of agents. And each of these agents is associated with certain characteristics. They're associated with parameters, things that are more or less constant features of them. Maybe it's their gender or their ethnicity. Maybe it's their birth weight that they came into the world with. Maybe for the sake of the model, we're simulating over a small period and we treat their income as fixed. A simplification, but suitable for many models. Secondly, there's their state, aspect of their current situation. For example, their age, their smoking status. These are aspects, things that can change over time. Their networks, their preferences. These things evolve over time often. These are aspects of their state. They're not parameters because they're evolving. Then there's rules for evolving the state. Sometimes we distinguish actions that will actually change it, and the rules, the situations under which those particular actions apply. And that's a different way of characterizing it. But these are some rules that govern sort of how does their state change over time. So if I'm infective, in what way do what's associated with the situation for me going from this to recovered? There's a certain rule for that, like a certain chance per unit time. Or maybe I lose immunity, I'm recovered, and after a certain fixed amount of time, I lose immunity, 150 days. Remember that? That was a rule associated with evolving my state. If I'm recovered 150 days, if I become recovered 150 days from now, I'm going to become susceptible. Remember that from this morning? And then finally, some means of interaction with other agents or environments. And here's a very powerful feature of agent-based modeling, putting people in spatial context and topological context, putting them in networks, maybe more than one network, a family network, colleague network, a needle-sharing network, a sexual network. Different types of networks potentially, but I'm embedded in it. I'm a situated actor within those contexts with limited understanding, limited view. I hear things from my friends, but I'm situated in these contexts. There's a time horizon, characteristics, like for example, if it's in discrete steps or if it's continuous, and some initial state. System dynamics says it all. You have to specify an initial state. So in system dynamics modeling, we kind of characterize a population according to their characteristics. We divide them into different categories. Susceptible people, exposed people, infected. We count the number who are in each category, who have each sort of set of state and characteristics. In agent-based modeling, we instead organize the population not by state, but organize it by individuals, where each individual keeps track of their current state, keeps track of their current characteristics, their parameters, and evolve. So here we have this different way, system dynamics. With an aggregate model, we organize by state and properties, and for each such subdivision, we count the number of people in that. For agent-based model, we organize by individuals, and for each one, we keep track of their state and their parameters. Okay, so suppose you have a population in the model. In the simulation, that population will be a set of individuals. We saw that a little bit this morning. Those individuals will have parameters like ethnicity, sex, and income. Each individual will have a certain values for those parameters. So we may have, for example, an African American female here with a certain income, or an African American male with a different income, or a Caucasian male. So we'll have individuals who have those properties in the population, lots of individuals with particular values of those properties. They will have state, by which they evolve over time, and their state may be classified according to different dimensions. So, for example, whether they're infected or not, their attitudes towards care seeking, etc. And then a means for interacting with each other. For example, interacting over a network. There's often this emergent behavior we saw in that first example. We saw it in system dynamics with values of stocks and flows. Here we might see it spatially as well. We might see it in these waves of infection like we saw in that early model. Or we may see certain types of health burden disproportionately clustering in certain regions of a population according to location and according to network context. Now, in contrast to system dynamics models, ABMs are typically stochastic. Just like that first model, we had the ragged edge of that red disk. And to make sure model results we've seen are not merely flukes, we typically run it several times over to make sure we're picking up regularities and not merely accidents. Stochastics here is an asset in the sense that we can perceive variability that might be reflective of variability in the world, but it does have a fair burden computationally because we need to run the model many times. So a given run of the model might yield some results at the end of the model, but running it many times might yield to distributions and results. Sometimes the model infection takes off and sometimes it doesn't, for example, in that final set of runs. The final one that I'm going to talk about, and then we can go to lunch, is discrete event modeling. Discrete event modeling is another older tradition. Like system dynamics, it dates back to, in this case, the 60s, I think, with the work of Carl Tocher. System dynamics, the late 50s with Jay Forrester. Now, this work is typically operationalized at a closer level of detail than traditional system dynamics models. It depicts workflows where progress along the workflow is undertaken by entities. So entities, say patients in a hospital, might flow in. And those individuals flow through a system of processes which operate upon them. Think about an individual coming in, being triaged by the triage nurse, waiting, being taken in for a workup by a resident, being placed in a bed, undergoing some sort of imaging. These are workflows. Their progress through that workflow will depend on resources. So the triage nurse, you've got to wait for the triage nurse so she's free. That's a resource. She's a resource, and there's a queue because there's lots of people waiting for that resource. That resident who does the workup is another resource. The CAT scan is a different resource to which this person might be subject. So there are entities at an individual level that flow through that are operated upon by these processes in a fashion that is governed by availability of resources. And notable features of this that are emergent include, for example, queues. The fact that there'll be a queue forming waiting for the triage nurse because there's many people waiting, there's many people who need to be triaged, and just one triage nurse on. These processes will be operating on entities flowing through, and there's typically limited resource pools that have limited capacity in terms of number of procedure rooms or number of piece of imaging equipment, number of nurses, other healthcare workers, etc. Now, discrete event modeling has an exquisite ability to represent processing of agents or entities in the context of limited resources. One of its very powerful uses is the capacity to identify the impacts on health service delivery, throughput, or waiting time of the level of resourcing. How much would increasing resources help? Of where to place those resources and how to govern the sort of coordination between these resources and its interaction with facility layout. So Narges, one of the TAs here, has a very nice little model, for example, which shows individuals circulating within a nursing home over time with the cleaners coming in, and that shows some of the uses of it. One of the other models that comes with AnyLogic on ED showing a trauma unit is also very powerful for communicating sort of how the layout of the facility interacts with movement of individuals. The point here is that movement of individuals is endogenized. It's actually something produced from the model based on how far an individual has to go from one place to another. And that can be captured very well by the model. It has comparatively less reliance on computational skills than, say, agent-based modeling, but it is a technique that has limited ability to scale to handle very flexible rules, such as rules that might operate within a hospital as a whole, and limited ability to take into account, for example, inter-entity interactions, such as spread of knowledge, attitudes, beliefs, or pathogens between people within one of these processes. So this is a model here, I think built by Kurt, one of the TAs, as part of our work with the Ministry of Health, and illustrates sort of progress of individuals in the context of a hospital. I'll just mention a word or two about social networks analysis. This is not covered in this boot camp. Much of social network analysis is traditionally covered in a static way, meaning we don't have models that simulate over time the network, but there is an important class of actor models that do combine in elements that are often seen in agent-based models with evolving agents. So typically with social network analysis, we are studying, for example, how the structure of a network ends up affecting the attributes of individuals within the network. We're identifying relational attributes of nodes, for example, the degree to which they're between other nodes, the number of connections that they have. And we seek to understand, for example, how overall network properties, its structure, the patterns exhibited, relate to individual characteristics, for example. There is a dynamic component of it. Most people tend to apply it statically, and it can really be powerful as a tool for understanding structural relationships between different parties, the impact of individual network position on their risks, for example, or on patterns of health, to help identify influential or critical parties based on network structure alone. But it is particularly powerful when combined with agent-based modeling, which has the ability to depict network structure in a rich way, so that you can capture, for example, you can incorporate things, data from social network analysis into dynamic models to parameterize an agent-based model. And agent-based model can explain sometimes where the patterns seen in social network analysis come from. Okay, there's a whirlwind glimpse. We're going to see more about these patterns this afternoon, about these types of traditions. But first, we will go to lunch, and Jeff will be discussing some about system mapping using both system dynamics tools and a very novel tool that he has contributed, and I've helped refine a little bit, related to agent-based modeling. This will be over at the faculty club, and I am asking the TAs to lead people there. Okay, so The TAs will be out here in the hall, and if you could follow them, they'll lead you over to the club. When we go in, you will go in the front door, turn left, and you can go all the way down to the room at the end there, and you'll be taking a buffet lunch, which will be just over in the main area. You'll see it to your right as you're heading through. Okay? You can serve yourself from the buffet. Yeah, we're going to be locking this room. Okay?